Have you ever looked into your child's mouth and thought, where are the teeth? Or maybe your child had a few teeth come in, and then nothing happened for months and months. For many parents, the first tooth is a joyful milestone. But when that milestone gets delayed, it can quickly turn into worry, confusion, and even feared as a dentist. I often meet parents who are deeply concerned about non-erupting teeth in their children. Some think it's just late teething. Others fear it's a sign of a serious problem. And most of them simply don't know what to expect or when to be alarmed. In this video, we're going to dive deep into a lesser-known but extremely important topic in pediatric dentistry. Non-erupting teeth in kids. It could be one missing tooth. It could be a whole set of delayed baby teeth. Whatever the case, it's not something to ignore. Why is this topic important? Non-erupting teeth aren't just about cosmetics or cute baby smiles. They can lead to serious complications if not caught early. Speech development problems, eating difficulties, crooked permanent teeth, jaw growth abnormalities, social anxiety, and bullying in school-age kids. Sometimes non-erupting teeth are simply due to a small delay in development. But other times, they can be signs of deeper issues, like impacted teeth, supernumerary teeth, extra teeth blocking the way, hormonal disorders, or even hidden infections or trauma. Magnifying glass tilted left. What you'll learn in this video. In this comprehensive video, we'll uncover everything you need to know. White heavy checkmark, what tooth eruption is and how it normally works. White heavy checkmark, what it means when a tooth doesn't erupt, and the different types of eruption failures. White heavy checkmark, what causes non-eruption, from genetics to trauma to medical disorders. White heavy checkmark, warning signs. Every parent must watch for white heavy checkmark, when to worry and when to wait. White heavy checkmark, diagnostic tools dentists use to detect hidden teeth. White heavy checkmark, full range of treatment options, including orthodontic help, surgery, and monitoring. White heavy checkmark, tips to help your child develop a healthy and beautiful smile. Direct hit. Our goal be the end of this video. You'll have clear knowledge and peace of mind. You'll understand what's normal, what's not, and what steps to take if your child's teeth are not coming in on time. Clapperboard. So, don't skip a second of this video, because sometimes a single missing tooth can reveal a much bigger issue. Welcome to Mr. Teeth. I'm your dental guide, and today, we're uncovering the mystery behind non-erupting teeth in children. Let's get started. What is tooth eruption? Before we talk about why teeth don't erupt, let's first understand what tooth eruption actually is and why it's one of the most important processes in your child's development. Brain definition. What is tooth eruption? Tooth eruption is the natural process where teeth emerge through the gums and become visible in the mouth. That it's not just about appearance. It's about function, speech, digestion, facial structure, and overall oral health. This journey begins inside the jawbone and ends when the tooth fully appears in the mouth. But did you know that this process is not random? It follows a very specific and predictable timeline. Calendar timeline of tooth eruption, baby teeth and permanent teeth. Baby primary, baby, teeth eruption schedule, lower central incisors, 6 to 10 months upper central incisors, 8 to 12 months lateral incisors, 9 to 16 months first molars, 13 to 19 months canines, cuspid 16 to 23 months second molars, 23 to 33 months memo. Most children will have all 20 primary teeth by age 3. Child permanent teeth eruption schedule. First molars and central incisors. 6 to 7 years lateral incisors. 7 to 8 years canines and first premolars. 9 to 11 years second premolars and second molars. 10 to 13 years third molars. Wisdom teeth 17 to 25 years, or may never erupt. Backhand index pointing right. These timings may vary slightly, but major delays, 6 months or more, need evaluation. Microscope. How do teeth erupt? The science behind it. The process of eruption is both biological and mechanical. Here's what happens step by step. 1. Tooth germ formation inside the jawbone. Tooth germs develop from special cells that form enamel, dentin, and pulp. 2. Crown development. Once the crown is fully formed, it prepares for eruption. 3. Root formation begins as the root grows downward. It starts pushing the crown upward toward the gum surface. 4. Bone remodeling. Bone cells clear the path, and the surrounding tissues stretch and adjust to allow the tooth to move. 5. Eruption through the gums. The tooth cuts through the gum, creating what we call teething, often with swelling, drooling, and irritability. 6. Final positioning after the tooth emerges. It continues to adjust until it fits perfectly in the bite. Occlusion. Police Garlight, why is this process important? The timely eruption of teeth is crucial for many reasons. White heavy checkmark speech development. Front teeth play a big role in forming sounds like S, F, and TH. White heavy checkmark proper chewing. Molars and canines are vital for grinding and tearing food. White heavy checkmark facial growth. Teeth help shape the jaw and maintain balance in the face. White heavy checkmark guide for permanent teeth. Baby teeth hold space for adult teeth. If they erupt late or don't erupt at all, adult teeth may get crowded, blocked, or misaligned. Warning: what's considered a delay in eruption. Small orange diamond: if no teeth erupt by 12 months, it's considered delayed. Small orange diamond: if there is asymmetrical eruption, teeth on one side erupting but not the other, it's suspicious. Small orange diamond: if a permanent tooth is due but hasn't come in even after 6 months of its expected time, it must be evaluated. Alarm clock: remember, every child is different. Some kids are naturally late bloomers, but there's a fine line between normal variation and a real problem. DNA factors that influence eruption timing. Several factors determine when and how your child's teeth come in. 1. Genetics: if parents had late teething, the child might. 2.2. Gender: girls often erupt teeth slightly earlier than boys. 3. Birth conditions: premature babies may show delayed eruption. 4. Nutrition: deficiencies in calcium, vitamin D, or overall malnutrition can slow down eruption. 5. Health disorders: conditions like Down syndrome, hypothyroidism, or cleidocranial dysplasia can delay eruption or cause failure to erupt. 6. Infections and injuries: early trauma to baby teeth can affect the growth and eruption of permanent ones. Brain quick tip for parents: start cleaning your baby's gums with a soft cloth even before the first tooth appears. Once the first tooth comes, start brushing twice a day and schedule the first dental visit by age 1, even if there's only one tooth. Clapperboard. Wrapping up section 2. Tooth eruption may seem like a natural event, but it's actually a complex and carefully timed process. When it's delayed or disrupted, it can be an early signal of an underlying problem. That's why understanding the normal process is step 1 in identifying abnormal patterns. Up next, we'll explore exactly what it means when a tooth doesn't erupt and how to tell the difference between a simple delay and a real problem. Stay with us. Now that we understand how and when teeth are supposed to erupt, let's look at what happens when they don't. This is where things get concerning for parents and critical for dentists to evaluate properly. Tooth definition. What is a non-erupting tooth? A non-erupting tooth is a tooth that fails to emerge into the mouth within the expected time frame. It may be delayed in coming out, delayed eruption, be trapped inside the bone or gum, impacted, or simply fail to develop the eruptive path, embedded. These situations can affect both baby teeth and permanent teeth, but in kids, we're usually more concerned about the primary, baby, teeth because they're the first indicators of developmental progress. Book's key terms you should know. 1. Delayed eruption. The tooth is forming normally, but is taking longer than usual to come out. Example: a baby's lower front teeth still haven't appeared by 14 months. 2. Impacted tooth. The tooth has developed but is stuck and cannot come out due to obstruction, like lack of space, bone density, or an extra tooth blocking it. Example: a permanent canine is stuck in the upper jaw at age 11.3. Embedded tooth. The tooth is completely surrounded by bone or gum tissue and has no eruptive force or is not on a normal path. Often associated with systemic issues or developmental disorders. Brain. These may sound similar, but each has a different cause, treatment, and long-term outcome. Magnifying glass. How is a non-erupting tooth diagnosed? The challenge is, you can't always see a non-erupting tooth. You might just notice an empty space or no space at all. So, here's how dentists evaluate it. 1. Clinical examination. We assess whether the baby teeth are present, exfoliating, falling out, or retained beyond the expected age. 2. Palpation. Feeling the gums. Dentists may gently feel the gums to see if a tooth bulge is forming underneath. 3. Dental x-rays, radiographs. This is the most reliable method. Panoramic x-rays, OPG, or intraoral periapical films can reveal White heavy check mark if the tooth is present. White heavy check mark if it's formed properly. White heavy check mark its position inside the jaw. White heavy check mark if it's being blocked by another structure. 4. CBCT, 3D dental scan. In complicated cases, cone beam CT provides 3D imaging to accurately determine the tooth's location and angle. 5. Review of medical and family history if delays are affecting multiple teeth or are associated with growth delays. We check for systemic or genetic conditions. Baby, is it common in children? Yes. Non-erupting teeth in kids is not as rare as people think. Child in the primary dentition, baby teeth delayed eruption is more common than true impaction. Premature birth, poor nutrition, or genetics can play a role. Adult in the mixed dentition, when baby and permanent teeth coexist impacted or ectopically. Erupting permanent teeth, especially upper canines and lower second premolars, become a serious concern. Balance scale delayed versus non-erupting. What's the difference? Feature delayed eruption, non-erupting, impacted/embedded. Tooth presence, yes, likely to erupt on its own, possibly unlikely seen in x-rays, yes, may need surgery/intervention, usually no, often yes, cause minor delay. Nutrition, late developer obstruction, abnormal position, pathology. Ear in short, delayed eruption is often temporary. A non-erupting tooth usually needs help. Triangular flag, when should you be concerned as a parent? If you notice any of these signs, it's time for a dental checkup. No sign of first teeth by 12 to 14 months. Uneven eruption, teeth on one side only. Swelling or bulge where a tooth should be. Baby teeth not falling out on time. Missing space in the jaw for a new tooth. Adult tooth seen on x-ray, but no eruption happening. Family history of impacted or missing teeth. Bell, early intervention makes a huge difference. The longer a non-erupting tooth stays stuck, the harder it becomes to bring it into place. Pushpin real-life example. Story. Let me tell you about Sarah, a 9-year-old girl brought in because her upper canine hadn't erupted on one side. The other side was fine. X-rays showed the tooth was present but angled in the wrong direction, heading toward the nose. We caught it just in time. A small surgery and orthodontic treatment helped guide the tooth into the right position, and her smile is now perfect. But if they had waited another year, she would have lost the space permanently and needed tooth removal. Brain moral of the story: early detection, timely action. A non-erupting tooth isn't just about a missing tooth. It's about what's happening under the surface, whether it's impacted, delayed, or embedded. Understanding what's going on can prevent bigger problems later. In the next section, we'll uncover why these teeth fail to erupt, the most common causes, from genetics to hidden cysts. You won't want to miss it. Now that we understand what a non-erupting tooth is, the big question is, why does it happen? Why do some teeth erupt right on time, while others stay trapped beneath the gum, hidden like secrets waiting to be discovered? The answer lies in a combination of genetics, anatomy, medical conditions, nutrition, and sometimes just plain bad luck. In this section, we'll break down the most common causes, so you know exactly what to look for and what to discuss with your child's dentist. DNA 1. Genetic factors. Your child's teeth don't develop in isolation. They follow a blueprint written in their DNA that if you or other close family members had late eruption of baby or permanent teeth, missing teeth, congenitally absent, extra teeth, supernumerary, crowded teeth, then your child is more likely to experience the same. Brain example. In conditions like cleidocranial dysplasia, there's a strong genetic link that causes multiple non-erupting and supernumerary teeth. Even outside syndromes, many eruption patterns are inherited. Bone 2. Jaw size and space issues, crowding. Imagine trying to park 32 cars in a 20-car garage. That's what happens in dental crowding. There simply isn't enough space in the jaw for the tooth to emerge. This can happen when the jaws are too small, the teeth are too large, baby teeth fall out too late, retain primary teeth. There's poor spacing between teeth, baby. In many cases, this affects permanent canines and second premolars, which get pushed out of line and become impacted. Ice cube 3. Supernumerary teeth, extra teeth. Sometimes, a child develops extra teeth in the mouth that don't belong. These are called supernumerary teeth, and they often block the normal path of eruption. Small orange diamond. The most common type is a mesiate ends, an extra tooth between the two upper front teeth. Small orange diamond. It can push the permanent incisors out of line or prevent them from coming out altogether. These teeth can only be diagnosed with an X-ray. They often require surgical removal. Brick 4. Physical barriers, cysts, tumors, or bone overgrowth. Non-eruption may sometimes be caused by a physical obstacle in the bone. A dentigerous cyst forms around the crown of an unerupted tooth. Painless and slow-growing, can displace the tooth or damage adjacent roots. B. Odontoma. A benign tumor made of tooth-like material can block eruption of a nearby tooth. Requires surgical removal. C. Thick bone or fibrous tissue, especially common in children with delayed resorption of primary roots. The erupting tooth can't push through and remains stuck. Magnifying glass. Tilted left. These problems are often invisible from outside and diagnosed only on radiographs. Crosswords 5. Trauma or injury to baby teeth. If your child had a fall or injury to the mouth at a young age, it may have damaged the developing permanent tooth below. Intrusive injuries, where baby teeth are pushed upward into the bone, can cause deflection of erupting tooth. Ankylosis, fusion with bone. Root malformations. Eruption failure. Calendar. These effects may not show until years later, when the permanent tooth doesn't come in. Stethoscope 6. Systemic health conditions and syndromes. Several medical and genetic conditions can interfere with tooth eruption. A. Endocrine disorders. Hypothyroidism delays all aspects of growth, including tooth eruption. Hypopituitarism affects growth hormone, delaying bone and tooth development. B. Genetic syndromes. Down syndrome. Delayed eruption is common. Cleidocranial dysplasia, classic for multiple unerupted and impacted teeth. Gardner's syndrome causes extra teeth and jaw cysts. Ectodermal dysplasia. Few teeth develop. An eruption is severely delayed. DNA. These conditions often present with other symptoms too, such as short stature, skeletal anomalies, or delayed milestones. Leafy green 7. Nutritional deficiencies. Teeth are like any other part of the body. They need the right fuel to grow and emerge properly. Deficiencies in the following can delay or prevent eruption: calcium, vitamin D, phosphorus, vitamin A, iron. In cases of anemia, fork and knife with plate. Children who are malnourished, on highly restricted diets, or have chronic digestive disorders may experience delayed dental development. Sun. Vitamin D deficiency, in particular, leads to poor mineralization of teeth and bones, causing both delayed eruption and enamel defects. Crossmark 8. Ankylosis of primary teeth. Ankylosis is when a tooth becomes fused to the surrounding bone, preventing it from erupting or from falling out when it's supposed to. Most common in baby molars, leads to sunken appearance, and tilted adjacent teeth prevents permanent tooth from erupting in its place. Camera with flash X-rays reveal a missing ligament space around the ankylosed tooth. It usually requires extraction. Triangular flag 9. Primary teeth not falling out. Retain deciduous teeth. If baby teeth don't shed on time, they can block the eruption path of permanent teeth, causing impaction. Crowding. Eruption in the wrong location. Woman health worker. Dentists often recommend early extraction of over-retained baby teeth to allow proper eruption of adult teeth. Brain 10. Idiopathic. No clear cause. In some cases, despite all tests and evaluations, no clear reason is found. These cases are termed idiopathic eruption failure. It may be due to a local disturbance in eruption force, unknown genetic mechanisms, environmental stressors during early development. Round pushpin management still involves intervention based on clinical findings, usually orthodontics or exposure surgery. So, now you know, non-erupting teeth aren't just a delay. They could be a sign of extra teeth, blockages, trauma, bone issues, systemic conditions, or even deep-rooted genetic patterns. The most important thing to remember: early detection saves your child from years of dental problems. In the next section, we'll discuss the signs and symptoms that parents like you should be actively watching for before it's too late. Signs and symptoms parents should watch for. Child, what should parents look out for? Non-erupting teeth often don't show clear signs at first, but some warning signals include: no baby teeth by 12 to 14 months, gaps where a tooth should be, even past the normal eruption age, teeth erupting only on one side, asymmetrical eruption, swelling, bulging, or lumps in the gum, delayed shedding of baby teeth, crowding or overlapping teeth, speech or chewing difficulties, tooth pain without visible reason. Direct hit. Why this matters: catching these signs early can help your dentist plan the right treatment before bigger issues develop. Diagnosis and examination tooth. How do dentists diagnose a non-erupting tooth? Dentists use a step-by-step approach. 1. Clinical examination, checking eruption sequence and symmetry. 2. Palpation, feeling for bulges or missing teeth. 3. Dental x-rays, OPG or periapical, to detect hidden, impacted, or extra teeth. 4. CBCT, 3D scan, for complex impactions or surgical planning. 5. Medical history review, to check for genetic or systemic causes. Tear-off calendar, when to visit a pediatric dentist. If your child's first tooth hasn't come by 12 to 14 months, or if adult teeth haven't erupted 6 to 12 months after expected time. Treatment options. Light bulb, what can be done? Treatment depends on the cause, age, and the type of non-eruption. Eyes observation, for mild, natural delays. Tooth extraction of retained baby teeth. To clear the path. Scissors. Surgical exposure, if the permanent tooth is blocked or impacted. Magnet. Orthodontic help, braces to pull an impacted tooth into place. Brain multidisciplinary approach, for syndromic or systemic cases. Repeat button, early treatment can reduce the need for braces or surgery later. Preventive tips for parents. Family, how can parents prevent this issue? Schedule first dental visit by age 1. Monitor eruption using an eruption chart. Maintain proper oral hygiene from infancy. Ensure a nutrient-rich diet. Vitamin D, calcium, iron, protect teeth from injury, especially during toddler years. Take X-rays if eruption seems off by more than 6 months. Direct hit prevention is better and cheaper than correction. Long-term effects if not treated. Hourglass not done. What happens if a non-erupting tooth is ignored? Misalignment and crowding, jaw and bite issues, malocclusion, speech development problems, facial asymmetry. Higher cost treatments like surgery, braces, or implants. Emotional stress or low confidence, especially in school-age kids. Stop sign, don't wait until permanent damage is done. Non-erupting teeth may sound scary, but with early diagnosis, the outcomes are often very positive. That if you notice anything unusual, don't panic. Just consult a pediatric dentist. Most cases can be resolved with simple treatments, and your child can go on to have a healthy, confident smile. Sparkling heart, you're not alone, and your child is not broken. With knowledge, care, and timely action, we can fix the problem before it becomes one.